The poet Ralph Waldo Emerson wrote, "When it's darkest, men see the stars." During the darkness following injury, patients see the stars of Maryland's trauma and EMS system. Stars that align to form a constellation so bright, so powerful, that it can overcome death. On a very dark night in December 2007, a young man named Robbie Smith sees those stars. It's after 7 o'clock when Robbie leaves his girlfriend Amber's house. His Honda Civic hugs the twists and turns through Greenspring Valley. Robbie's a car fanatic who hopes someday to become a mechanic. He loves to work with his hands. The Civic picks up speed as it descends the hill near Rolling Ridge Farm. It's only 2 miles to his house, but it'll be months before Robbie ever makes it home.
I remember telling him to get home, and normally I would say, "I love you, be careful of the deer," and of course that night I didn't.
He left around like 7, and then we kissed, and then he said, "I love you," and then I was just waiting for his phone call.
In the process of finishing up with the juniors, when we got alerted for a 1050 PI rollover at Tufton and Worthington.
And they put it out as a rescue that someone was trapped in the vehicle. We responded with our rescue squad and our medic unit.
As we proceeded down the road, when we got to the scene, we found what used to be a little Honda had gone through a fence and was out in the field with major damage to the car.
As I got closer, it's now apparent that he's got a fence post sticking out of his throat. And I can see it sticking out probably a foot and a half out the front of him.
It was pretty amazing. I've never seen anything like it before.
I'm thinking the guy's deceased. Well, then he looks over at me and says, "Get me out of here." I mean, in a nice, calm voice. And I was just like, just shocked. You know, I was like, "Okay, well, we're going to get you out of here."
So I crawled in through the rear hatchback, and I laid up in the vehicle with him, supporting the fence post. And at this point now, being in the vehicle, I could tell that the fence post came through the back of him. Right around the left shoulder blade, it came out. And it was about, I would say, 8 or 9 inches sticking out the back of him.
There had to be some kind of divine intervention, and he survived that.
He kept saying that his throat hurt, and we were telling him he had a little splinter, and he kept saying he could see it. So we told him, "You got a big splinter."
I jumped out, grabbed the tools, went over, started cutting the car apart, taking the doors off, starting to take the roof off.
I was then able to gain access to his throat with the fence post and his back, basically stabilizing him in the seat until we could get the backboard underneath of him to be able to remove him from the vehicle.
You have the one person on the outside of him, and you got 2 of us in the car, and we're all pretty much huddled up together right next to each other, working together as a team.
Once we got all the companies in place and we started the rescue, myself, the Assistant Chief of Reisterstown, the Chief of Reisterstown, Tom Jeffers, EMS aide all got together to try to figure out the best way to remove the patient from the car.
Shock trauma's online.
Shock trauma County 450. Yeah, I'm in the Clinton area from the Boulder County with a 17-year-old male, motor vehicle crash, rollover. He has an impaled object through his neck into his left shoulder. He has no feeling or sensation in his left arm. We're in process of extricating him at this time. I will get you information as soon as I get more assessments.
Trauma copies.
It's almost 30 minutes into Robbie's golden hour, the optimal time to reach definitive care. The rescue team knows the more time they take in the field, the less the chance Robbie has to survive. Trooper 1 can add precious minutes, but moving Robbie to the helicopter is easier said than done. This transport requires ingenuity and precision. One wrong move and Robbie will bleed to death.
Well, the trooper was able to land in the field right adjacent to the scene. We actually took him right from the car to the trooper.
how are we going to get him onto our board with this piece of wood sticking out his back? Because if we laid him on the board, now we were going to have the possibility of movement created in the front.
So we ended up using sliding him out onto a backboard and using cribbing off our rescue squad and cribbed underneath of him to make a void and where the post could sit in the void. So he's kind of propped up.
I briefed my pilot, Mike DiRosario, on what we had and just basically asked him if he could, do whatever he can to minimize movement, lifting off and landing at the trauma center.
I had the one EMT sitting on my one knee supporting his airway, and I had the flight paramedic on my other knee basically taking vitals, making sure everything was strapped in and everything was okay to fly down to the trauma center.
Thank God it wasn't raining or anything, because that's a long ride down to shock trauma, and the bumpy ride and everything. Anything could have happened, so that helicopter was like the greatest thing in the world.
I got my stepdad, Mike, and we basically just went out and I pulled up the accident scene. Before we left the house, I was already in tears because I didn't know what to think. And then
within about 5 minutes, they called and they said Robbie was in a car accident. And I just knew.
He kept talking to us about his mom, and he kept talking to us about his girlfriend. He wanted us to let him know that he was okay.
The way we all worked together that night was excellent, and I think the kid was lucky. I think all the stars were aligned for him that night.
A shooting star is a streak of light in the night sky. Trooper 1 streaks through the darkness, transporting Robbie to shock trauma in just 13 minutes. Pilot Mike DiRosario gingerly lands the aircraft, limiting any movement that may cause the boarding to shift in Robbie's neck. The EMTs continue to cradle Robbie in their arms as he's whisked down the elevator to the TRU. Amazingly, Robbie is still awake, alert and following commands, but he's diaphoretic and his pulse is high in the 150s.
When I took him into the trauma center, at that point I know he's in the best care possible.
I think the reason he wasn't killed instantly is because the large piece of fence post was under such pressure, so it sort of tamponaded off the bleeding that would have led to exsanguination.
it was amazing. He was like wide awake and talking to me, and I couldn't believe he was still talking.
What was scary about Robert's case was the first thing he asked me is if he was going to die. And whenever a patient asks you that, it's a bad sign because there's some intuitive thinking going on that they know something seriously bad's going on. And there was.
First thing he said to me is like, please make sure you call my mom and tell her that I love her. And I almost started crying. I'm like, okay, I will.
You're afraid that would be the last time that you hear those words. So.
Robbie clearly needs surgery, but that requires something never done before at shock trauma. Firefighter J.P. Snyder will hold the 260-pound teenager while they operate. Snyder's arm is already numb from lack of circulation, and his fingers are turning blue, but he never once falters. Robbie's wide awake as Dr. Johnson takes an oscillating saw, borrowed from orthopedics, and begins the delicate procedure to remove the fence post.
When we went to the operating room, they put glasses and a mask on and then draped a gown over top of my turnout gear while I was supporting him, so I wouldn't be able to remove my arm.
But when you're going to try to get a breathing tube in somebody and intubate him, you want him laying down, you want him supine. But you can't do that because he's got this big chunk of wood.
I had to cut the anterior part of this fence post off, which was great. We could get access to his airway at that point in case we needed to do something emergently as well. But I also had to cut the fence post off in his back so that we could actually lay him down in the operating room bed.
But that's just an amazing way of having to do things. But that's what you have to do. It's not, I'm not sure if you picked up a book that it'd be written anyplace, but that's what you do. That's when experience matters.
We had to tee this off, we call it, if you will, over the clavicle and actually remove part of the clavicle to expose all the great vessels and nerves in the left chest. And they were all injured. The subclavian artery, subclavian vein, thoracic duct, brachial plexus. He actually even avulsed his left thyroid lobe off in his neck. So his neck and left upper chest were devastated. So at that point, it's all about stopping the bleeding so you don't exsanguinate.
Right after Dr. Johnson came down to let me know that what they've done, at that point he still had his arm. He let me know right then and there that that arm he would probably lose. And I remember telling him I didn't really care about that arm. Take the arm if that's what you need to do, as long as the rest of him is here.
During the first operative procedure, Robbie loses almost 6 liters of blood. That's all the blood in his body. It's replaced with 21 units of fresh frozen plasma, 12 units of cryoprecipitate, 16 units of red cells, and 5 liters of crystalloid. The 7-hour procedure successfully removes the fence post and stops the bleeding. But the injury has decimated the entire vascular structures of Robbie's neck, upper chest, and left arm. It's also introduced a host of infections that will ravage Robbie's body and challenge the skill and the will of the trauma and the ICU teams.
I admitted him when he came up to the floor, up to ICU, so he came up pretty sick, straight from the OR. Chest was still open, needed a lot of fluid. Still needed a lot of, it kept me and Scott busy for a couple days.
When they first come up, every 15 minutes, you're charting vitals, as far as the medications and wound care and, it's constant. You're just assessing every 15 minutes. When you come in for 12 hours, it's 12 hours, and that patient is in your hands.
So I think when you have an injury like that, you really worry about some of the side effects of the immediate the vascular repair and how the body deals with that.
Life over limb. So you try to save their life, you try to save the limb, and then you try to save limb function. In younger people, it's a little more difficult because you don't want to put them at risk for losing their life or even getting sicker by trying to keep a limb that might not be viable. On the other hand, once you've committed someone to amputation, you've committed them to amputation. So it's a difficult call in younger folks.
We were concerned that maybe this would be a life-threatening injury because of infection. We knew that we could amputate, but we weren't sure if we could clear his entire body from infection that he had gotten from the initial injury.
I remember her holding my hand and just saying, he's better than what he was when he first came in. I can't tell you if he's going to make it, but he's doing better.
Day after day, Robbie returns to the operating room where surgeons wash out and debride his wounds. Each necessary procedure is another assault on his already battered body. By day 4, it's clear there's no way to save Robbie's arm. But in a stroke of genius, orthopedic surgeon Dr. Andy Egelsater recycles the arm to reconstruct the gaping hole in Robbie's chest.
We were missing a piece of artery here, which we had excised, and we used some of the muscle of the upper arm. Remember, he's lost his arm to here, actually flipped it over backwards and hooked up this piece of artery, which would be down here, up here. So now you have a big, nice vascularized bundle of muscle to obliterate that space and still keep the scapula or the shoulder blade, so you don't have to remove that.
Within probably the first week, he had like about 12 surgeries, and probably more than that. Heart rate was off the monitor. He was on life support.
Every intervention we do is a trauma may not be of the same magnitude, but it is little insults, which is part of the healing process, and the body can't tune out or filter out to what gradation it'll respond to it. And over a period of time, I think those repeated insults do add up.
The only thing I'm worried about is he going to live? And the only answer I would get was, no. He's young and he's resilient. He's got a long road. He's a sick little boy. That's what I got.
So I just told her, Denise, you have to wait. He's fighting this thing. And he'll fight it and he'll beat it. He's a strong boy.
You're treating the whole family as well. Everybody's going through it's a very traumatic experience, and you just have to try the best to explain things, and try not to scare them.
We feel like a family here, a family that's trying to do what's best for the patient, and that's a good thing. We get involved with regards to chest physical therapy to kind of help the process with regards to weaning him off of the ventilator quickly. Again, he was a young kid, so his lower extremities, we wanted to maintain the strength with his extremities as much as possible. So we get in and make sure that he can do range of motion, strengthening exercises. As long as he's able to be alert and follow commands, we get involved.
I think it was like the second day I walked in there, and they asked me if I could get him to respond to me. And I asked him, I said, if you can hear me, can you squeeze my hand? And he squeezed my hand.
But even though he had a significant injury, he was able to participate with us. He was able to stand on that second day, which was huge. And his vital signs tolerated the whole transition.
A miracle. Because everyone kept saying, he won't make it. But inside I knew, because I know who the person he is, he would, because he's strong.
Robbie spends Christmas 2007 in the ICU. The following day, he's successfully weaned from the ventilator and is able to breathe on his own. 2 weeks later, he progresses to 6 North Intermediate Care. Still, Robbie battles blood clots, infections, sepsis, and anxiety. But like Orion in the night sky, Robbie and his Army in Pink are fighters. On January 10th, 36 days after his injury, Robbie is discharged from shock trauma. Now his fight continues at Kernan Orthopedics and Rehabilitation Hospital.
I remember admitting him. He came by ambulance, and I remember him being very nervous and very anxious, which was quite expected with the level of his injury and all that this young fella at 17 years old had been through.
Blood pressure was a really big issue throughout his entire rehab stay at Kernan, and also he had a wound vac, so he had to carry a little portable machine, so just like trying to balance that with a cane and things like that.
He must have been in an awful lot of pain with the extent of his injuries, but he always, if possible, denied the offer of pain medication.
His mom was here probably like 90% of his therapy treatment, so she was a very big support network, which I could see she wanted to help at some times. I was just like, sit on your hands and let him try to do it.
Actually, we thought that he would be at Kernan's for like a month, but he was only there for 10 days.
He was going back to his old self again. He was, back on his phone, texting on his phone. I knew he was himself again after he was doing that.
So even though he was anxious, he had to be in pain, his focus was on getting well and getting out of there. On the last day of his, when he was being discharged, reviewing his note, it said, "I'm ready to go home," in quotations.
He's come a long way. And some parts of, as oddly as it may seem, like the accident has helped him grow up a little bit too.
To be a part of the system is amazing. I mean, it's. I remember being a kid and just watching trauma on TV and seeing the pink scrubs and all that, and just that was. I knew when I graduated, this is where I wanted to be. It's where greatness happens, and to be a part of it's amazing.
It's just an amazing feeling to realize that you're just like a small piece to this person's puzzle, and just how many people are involved in one person's life.
Without the EMS system in Maryland the way we have it, Robbie wouldn't be here today.
This system has saved countless amount of lives, and here's just one example of many. Without that system, we don't know how many lives we might lose, and if it's just one life that we lose, that's one too many.
Next month, Robbie will escort Amber to the senior prom, and a week later, he'll receive his diploma from Franklin High School. Robbie still loves cars, but he's chosen to study computer science instead of auto mechanics. One footnote to Robbie's story. Back in middle school, Robbie thought he might want to be a firefighter. For a brief time, he was a member of the juniors program at Glendon Volunteer Fire Department. He was rescued by some of the same volunteers who trained him as a junior.